Welcome to topic area 3, recruitment, enrollment, and retention. This is part of the Inclusion Across the Lifespan 2 webinar series. My name is Stephen Wallace. I'm professor of public health at the UCLA School of Public Health and co-director of the Resource Centers for Minority Aging Research, which has done a lot of work over the years on recruitment and retention in elders of color. So in this webinar, we're giving you pre-recorded sessions by myself and my co-chair, Michelle Hemstra, and we'll provide a framework and some introductory principles and examples for this session. For the live session on September 2nd, we urge you to all attend that. We have an excellent panel of experienced researchers who will provide brief examples of successful recruitment and retention efforts from their own populations, and we'll have time for questions and answers from you. So we look forward to seeing you at that session. This is a follow-up to a workshop that was held about 2 years ago on inclusion across the lifespan, which was a new requirement at that time. And the summary report, which you'll see the link on the bottom here, gives us a whole set of challenges and solutions to recruitment and retention issues for older adults and children. Very briefly, they involve study structure and protocols, the lack of stratification, challenges with obtaining consent, lack of experienced investigators, lack of innovative enrollment techniques, and attrition. So these are all issues that dealt with older adults and children generically during that meeting 2 years ago. They also identified some solutions, including involving stakeholders, bringing in experts and community representatives, including clinicians who've worked with older adults and with children, making sure that there's resources and support to assist recruitment and retention, make study designs easier for participants to enroll in, a whole section on assessment of capacity to provide consent and making providing consent easier, including working with your local IRB so that they understand some of the issues, especially when you need non-family consent. So the workshop today on September 2nd, we're broadening the focus to look at diverse populations within the older adult and child age ranges. And specifically, there was a call for looking at racial and ethnic minorities, women, sex and gender minorities, rural isolated populations, and others in those specific ages of life that might encounter additional difficulties in recruitment and retention. I think it's important to think about this from an intersectional perspective because we're not simply adding race, ethnicity, or gender to the complications of recruiting older adults or children, but we're looking at intertwined and interacting statuses that create special needs for recruiting, retaining those populations. So the goal of this session, this brief webinar pre-session, is to think abstractly about the issues and then to discuss some evidence-based approaches on September 2nd to dealing with those issues. So briefly, I just want to remind you why the characteristics of older adults are a little bit different and how that might influence recruitment and retention. Most obviously, older adults are more likely to be retired and the least likely group to be in the labor force, although a substantial number still are. Older adults are more likely to see a physician. So in the youngest age group, about 1/5 have not seen a doctor in the past year at all. That's only 5% among older adults. Older adults are more likely to report functional limitations. So with each increasing category of age, more likely to be disabled in some way. And to the extent that that's going to affect participation in clinical trials, that's going to be a particular issue for older adults. And interestingly, but not surprisingly, older adults are less likely, first of all, they have a cell phone. And when they do have a cell phone, it's less likely to be a smartphone. They're also less likely to have internet use. And these disadvantages in communications are reinforced in rural areas and low-income households. So these are all characteristics where if you're thinking of older adults as a uniform population, if you're thinking of recruiting across uniform populations, that there are distinctions. Even within older adults, and this is the topic of this workshop, there's variation by different demographic characteristics. So in looking at race and ethnicity, This really shows you some of the variation within that category that we think of oftentimes as just a generalized group of older adults. So if you look at 3-generation households, about 1/5 of all Asian and Latinx older adults live in 3-generation households. That's going to provide a whole set of new issues that are rarely encountered when dealing with non-Hispanic white older adults, in terms of recruiting and retaining and motivations for participation and so forth. The income profile varies rather dramatically by race and ethnicity as well. So you can see here that 2 out of every 5 Latinx and African American older adults are below 200% of the federal poverty line. So to the extent that income is a factor in participating in clinical trials, it's going to be almost twice as much of an issue for Latinx and African American elders as for Asian and non-Latino white elders. And finally, limited English is highly prevalent among Asian and Latinx seniors. About half report some difficulty with English. In my experience, when you're dealing with health issues, even if an older adult can speak English and seems fluent, they often feel more comfortable in a native language because they don't want to make mistakes or misunderstand. So these are a couple dimensions that are important to think about when looking at racial and ethnic diverse elders. So recruitment and retention of diverse communities across the lifespan is actually not a new concern. This has been one of the cores in the Resource Centers for Minority Aging Research, RICMAR program, since it was started in 1998. So it's been around for a long time. A lot of the faculty have done research in this area. And in 2011, we sponsored a special issue of the Gerontologist. I was the executive editor of that issue that had a long series of papers on the science of recruitment and retention, specifically among ethnically diverse older adults. Some of the key themes that came out of that set of article was that it's important to understand components of cultural distinctions across groups, including values and beliefs, sources and dynamics of community cohesion, and the collective history of that community. And all of those are instrumental in reaching out to the different groups in your communities, and also necessitate sensitivity to their sociopolitical conditions. In addition, there was a lot of discussion about the need to access resources that allow for ongoing connections with research participants, not just during the time of recruitment and retention, but in between studies, so that a level of trust and engagement is developed with those communities. Last year, we held a workshop sponsored by NIA, also on strategies for successful recruitment and retention of minority elders as a Gerontological Society of America pre-conference. The URL here gives you the website that includes the PowerPoints from those. And I'll just mention at the very bottom, the selected papers from that, as well as some others, will be out this fall in a special issue of Ethnicity and Disease. So more recent research on recruitment and retention for older adults. Some of the topics included sensitive areas such as brain donation, interventions for Alzheimer's disease, which is a stigmatized condition, and behavioral trials, and suggested things such as registries, community engagement, and making sure that you show benefit to the community and engage family. Just to go back to what I mentioned earlier, it's important when you're thinking of elders of color to think about intersectionality. So this older woman may be Latinx, she may be an immigrant, a grandparent, perhaps living with grandchildren, likely lower education and income, but those are not simply additive characteristics that increase the difficulty in recruitment and retention or lead you in any particular direction in addressing ways to reach this older woman for a clinical trial. So you really need to come to an understanding of the intersectionality of those characteristics in her lived experience and in the lived experience in her community, and figure out the best way of reaching her and including her in your clinical trials. Now, of course, providing materials in Spanish, appealing to family values will be helpful in that process, but you need a more holistic understanding of the situation that she's living in to be able to bring her to a clinical trial. So finally, there was a suggestion in the request for information that came out for this workshop, which we found very useful, which is the 5T framework for recruiting older adults. So this was specific for older adults, but many of the dimensions here and in many of the other older adult issues that we discuss today and in September 2nd actually translate across older and younger populations. So the 5Ts are making sure you think about the target population in advance and avoiding exclusions that limit the generalizability of your study to any particular population. The teams include making sure that you have expertise on your team that, in the case of older adults, includes geriatrics and gerontology, would include members of the target population, and in the case of children, includes pediatricians or people who have an active knowledge of recruiting younger people for clinical trials. The time may take longer and you need to budget for that. If it's an older adult who's got a disability, it just may take longer for a visit. It may be more difficult to get people to sites if you're having people come onto your site. So you need to think about the time that it's going to take for a visit. And then tips to accommodate particularly comorbidities, age-related impairments, other issues that may require additional protocols for making your clinical trial both more attractive, but also easier to engage in by the older adult or the young population. And finally, incorporating appropriate tools, both to measure function. So across the life course, there are different issues that may take different measurements. And in this area, issues of cultural responsiveness and the tools that we use are particularly important as well. So simply because a tool was validated in a sample in Baltimore doesn't mean that it will have the same performance in a sample in San Antonio. So you need to be sensitive to the variation, whether it's race, ethnicity, gender, rural, and so forth, in the tools that you use. So that's a very brief overview of the issues of recruitment and retention in diverse communities. Encourage you to listen to the pre-recorded session by my co-chair, Michelle Hemstra, who has an expertise in pediatrics, and hope to see you all on September 2nd, where we have an esteemed group of experienced researchers who will be talking about some of the solutions they've come up with in reaching out to diverse populations in older and younger age cohorts. Thank you for joining us.